I guess I was diagnosed with depression when I was probably about 13 or 14 was the first time I saw a therapist or psychiatrist. And I saw a bunch throughout the time. I was probably 13, 14 through now. I was diagnosed with, I guess, OCD, generalized anxiety disorder, ADD, stuff of that nature. I was put on all kinds of prescription medications, Lexapro, Wellbutrin, Paxil, to name a few.
And from a young age, you think?
Yeah, and I always reacted not so great with all of them. I had like every side effect that was possible. I was living in California up until probably about 4 or 5 months ago. My dad called me and said that Dr. Carlson had suggested TMS therapy, and I researched it online. And I was a little apprehensive about it. It was strange. I had never heard of it before. But at that point, I was on Lexapro, and I had stopped taking it because the side effects just weren't worth what I was getting out of it. So I came here and started TMS therapy. My life with depression was not fun. I didn't really find enjoyment in everyday things. I hated going to school, also along with depression. I had social anxiety, things of that nature. It just took the fun out of everything. It took me a while to realize that that's what was wrong, and that depression was the problem. And I'm sorry, even going to work was difficult. I didn't want to wake up in the morning to go. Before I went to bed, I was wide awake, and waking up in the morning, I just wanted to go back to bed. So I'd say like day-to-day life, it was rough. It wasn't easy trying to hold a job, keep relationships up. It was very, very difficult. I could imagine it'd be very, very difficult dealing with a depressed person in a relationship. And now I feel much, much better. I have energy. I love life. I have passion for things I do. I enjoy going to work. I enjoy everything. I enjoy going to the gym. I really enjoy a lot. All my relationships are healthy, like I wanted before. And my sleep's good. Everything is really, really well. I have my ups and downs. I have my days, but I'd say the good ones get me through the bad. And I'd say the first week was a little bit rough. Getting used to the Neurostar machine and the tapping and the sound. It was a little bit rough for me the first day when I was getting programmed. It was 2.5 hours, so it was a little bit rough. It wasn't but by the end of the second week, I was falling asleep in the chair. It was comfortable. I was fine, and I didn't mind coming at all. For an 1.5 hour nap every day. And I would say probably by the maybe the middle or third to the fourth week, you could definitely see a difference. I don't think I noticed it at first, but everyone around me said I was starting to look better, starting to sound better. I was getting up much easier. My relationships were getting better with people. I wasn't so, cranky or agitated so easily. So I'd probably say around, the middle, the third, or fourth week, I could definitely tell something was getting better. Evaluate your history first, and see if the medications, like me, medications just were not working, and the side effects were just not worth whatever the medications were doing. I think that's basically what it comes down to, and how desperate are you, as a thing, and if medications haven't worked and you're not feeling great, it wasn't an option for me. It was it was just something I was gonna have to do, and it totally worked. I don't know. It's. I think. To at least give it a shot. You know what I mean? You could always get a week into it and decide it's not for you.